Hello, friends. Welcome to my first live stream. Let's see. We'll give about 30 seconds for some more people to come in the room since we just started. I'll make sure I have all my little notes prepared because sometimes I refer back to them to make sure I include everything I want to say. Let's see. Oops. Of course, sharing on Instagram that we're live now. All right. All right, we're going to get started. I'm going to bring up my notes. Okay. So the three kind of topics that I'm going to cover today are parts of this live, and I'm going to try to keep it to 15 minutes and do about 5 minutes each, are one, my thoughts and feelings about the term breast is best and fed is best. Next, I'm going to go over some educational topics around the science of breastfeeding. And then finally, I'll answer the 5 questions I picked out from the Q&A that was on Instagram and answer those questions. So just to start out, this is, of course, educational content. This is even really casual educational content, very similar to the on-the-go teaching that I do for patients in the office, in the hospital, and with medical students and residents, etc. So I'm speaking a little off the cuff. It's not going to be as rehearsed or have exactly the level of depth of some of my more rehearsed videos. And of course, none of it is personal medical advice. A lot of this is stuff you're going to have to discuss with your doctor, whether that be your OB-GYN, your lactation consultant, or your pediatrician about what's right for you and your baby. So without further ado, let's get started. So as an OB-GYN, I hear the terms breast, the fact that there are true, real, scientific, evidence-based benefits of breastfeeding compared to formula feeding for both babies and for mothers as well. I'm going to go more into those in the educational part next, but there are real scientific benefits. So because of that, we want to say breast is best, and we want to encourage as many people as possible to breastfeed because of those benefits. And when you add all those benefits up, there's big public health benefits as well. So the behind the scenes of using that term is just meant to try to get more exposure and more education out there about breastfeeding so that more people will do it. But an unintended consequence of that push to get more education, more advocacy, more support for breastfeeding for those benefits is that it actually then leaves a lot of people who have recently had babies feeling a lot of shame and anxiety if breastfeeding either doesn't work for them for some real reasons or is just not right for them. And then they're left with a lot of shame. They feel pressure, they feel really negative spiraled thoughts about their inability to breastfeed and that I'm unable to care for my baby in the best way. It may affect their mood and lead to postpartum depression and anxiety, especially things like low supply. And so the term fed is best is meant to reaffirm support for people who cannot or have made the decision not to breastfeed, and showing them that even though there are benefits to breast milk, if you love your baby and you're feeding your baby and showering it with love, then you are doing what is best for your baby. So both of these terms, I both disagree with and agree with. And I don't like using kind of either one because neither one I feel like truly fits what we should be doing when we're approaching feeding with a new family. So breast is best, true, but not complete, right? Fed is best, true, but not complete. So I really like to take the approach of one, educating about breastfeeding and breast milk so that we are making the decision based on good information. And then two, support no matter what a family's feeding situation is. Okay, it's both together. So an example for educate, I do see that people into the decision about feeding with the wrong information. So I've had people before think that there is no benefit at all to breast milk, and so they're not going to try it. Well, no, it's important to realize there is some benefit, right? Or come into breastfeeding saying, well, my sister or my cousin breastfed and it was incredibly painful for her, and I don't want to feel a bunch of pain. And the truth is, breastfeeding can be uncomfortable, especially right in the beginning, but it really shouldn't be something that's significantly painful and causes pain. And if there is, it can sometimes be addressed with a combination of lactation consultants or pediatricians, et cetera, OB-GYNs. So I make sure that we're coming to it in the right scenario. Another common one I see is women who their mental health is very important, maybe on certain medications, and they think, I can't breastfeed because of this medication. And there are actually very few medications where breastfeeding is contraindicated. And for many medications, breastfeeding is just fine. And so talking with your doctor and not just going off what you think, especially your OB-GYN and lactation consultant, will help you decide if your medication is safe for breastfeeding or isn't safe for breastfeeding. Because I have seen so many people think this is not going to be safe for the baby, but it is. So that we want to make sure education-wise, we're coming to the decision and the outlook to breastfeed based on the right information. Okay. And that's behind of the breast is best. And then there's fed is best. So I mentioned there are reasons that people are not breastfeeding. Okay. One of them is that it's not always a choice. Some people are not able to breastfeed, and there's a lot of different reasons for that. Okay. One of them is troubles with supply. Now, biologically, some people are unable to either exclusively breastfeed or be able to make enough milk to feed their baby. The behind on that, some of the reasons are, one is insufficient glandular tissue, which is a physical and anatomic problem with the breast gland tissue that does not mature and that does not participate in what's called lactogenesis, or basically making milk. Another reason can be hormonal. The breast to make milk rely on a hormone called prolactin that's created in the brain. And sometimes prolactin, its secretion and its ability to maintain breast milk communication and supply is not strong. We see that especially after things like a major postpartum hemorrhage or with other medical problems, or it can be in something that's not even diagnosed before, and we wouldn't even know about. So there's also different, having had certain surgeries or having had certain like mastectomy before. Obviously, that person cannot breastfeed if all of their breast tissue is removed, but other sometimes minor surgeries. Breast reduction can sometimes negatively impact many times breast milk supply. Breast augmentation usually does not, but it can. So lots of reasons. There's also baby reasons. Okay, some infants are not good at getting milk out, and some of them may have physical problems with getting milk out. A really good example of that is babies with a cleft lip or palate. They may not be able to feed at the breast at all. Now that those mothers or those people may be able to pump and give express breast milk, but again, they may not be able to breastfeed. Or babies that have poor tone. A good example of that is babies with trisomy 21 or Down syndrome. Often they have trouble with the strength of their latch. In my situation, my baby was a little bit early. So although he's able to eat at the breast and he's getting stronger as time goes by, at the beginning, he just didn't have the strength or the maturity to be able to feed for a full breastfeed. So that's why I was doing a lot of pumping and hand expression, et cetera, et cetera. So some people don't have the ability. I like to, instead of the choice, put in the ability camp also people who have a strong history of sexual trauma and sexual abuse. Sometimes breast stimulation is not possible for them without really truly bringing on a sense of past trauma. So I'd like to put that in the canon camp instead of the choice, because no one chooses to go through sexual trauma. But there's also a choice. And listen, I support people who understand the choice whether or not to breastfeed. Some examples of that. This is kind of a random example I thought of. So in my life, I do a lot of health promoting behaviors, right? I care about my health, so I want to protect my health. Meditation and mindfulness is a health promoting behavior. I don't do it. I know it has health benefits, but it just hasn't fit in my life, and I'm not really interested in starting it. And it's true. I mean, I do other health promoting behaviors, and I know that there's true health benefits to like meditation and mindfulness. It's just not for me. And it's not for me right now. Now, will I change my mind in the future? Maybe. Same with breastfeeding. If you understand that there are some health benefits and you're not making the decision based on wrong information, but you say that breastfeeding is just what's not right for me and my baby, that's okay. And I totally support you in that decision, especially when it comes to mental health. For people who are struggling with the breastfeeding relationship, having enough supply, the pressures of breastfeeding, sometimes it gets to be too much and they are just like, it has to end. Now, this is kind of a combination with not able to breastfeed and choosing not to, because if there's not enough supply, there has to be supplementation, and those things interact. They're not mutually exclusive, they're together. But I support people who just say breastfeeding is not right for me and that's not what I'm choosing for me and my baby. I think that's totally fine. There's so many ways to love and support your baby's health and development. And if breast milk is not the one that is right for you and your baby, that's okay. So that talk ended up being a little bit longer than I meant to in section, but I just want to say that there's both a breast is best and a fed is best. I don't like either phrase, but I see truth in both of them. It just requires more nuance. So quickly talking about some of the backgrounds of breastfeeding. So breastfeeding, a process that is both hormonal and physical. We rely on the breast to make breast milk. That process is in two phases. Lactogenesis 1 is actually happening during pregnancy. So your breasts have started making what we call colostrum during your pregnancy. Colostrum is it has components that are slightly different than actual breast milk, and are really beneficial for babies in that first few hours to days. Colostrum is made during pregnancy. It's available. Some people colostrum harvest at the end of pregnancy, but it's available when the baby's born for a little bit, and then that usually ends. And then lactogenesis 2 happens at the time of birth until the milk comes in. Lactogenesis 2 is stimulated from a gland under the brain that creates a hormone called prolactin, which then causes your breast to undergo lactogenesis 2 and create breast milk. Breast milk comes in at about day 3 to day 7. So that's a really wide range. Day 3 is what's a little bit more normal and a lot easier when it does, but there are several reasons that there can be a delay until day 7. And some of those have to do with either medical issues that happen during birth or just a person's individual biology and hormones, as far as the baby and what the baby needs. So a lot of my questions were about supply, and we're going to talk more about that. But what's important to talk about is that their baby will get colostrum and then may have some time where they're not getting anything in terms of colostrum has died up and then waiting for supply to come in, where supplementation may be necessary. Supplementation may or may not continue past that point, but when is supplementation necessary for your baby? This is a decision that's made in conjunction with your pediatrician and possibly your lactation professionals as well. There are criteria that pediatricians follow in terms of the baby's weight. There is an expected weight loss that happens in the first few days to week of life. That may not require supplementation, okay? But there's a percentage, and it depends on the amount of time, in conjunction with keeping track of the baby's wet diapers and dirty diapers, okay? And then other factors like the baby's blood sugars or bilirubin that may apply to your baby or may not apply to your baby. So the need to supplement or not is not simply my baby lost weight from birth weight, okay? It depends on the amount of weight they lose and all the other factors too, whether or not supplementation may be necessary. And that's a issue that you will help figure out with your pediatrician. And it's why you have pediatrician visits over the first week or 2 of life. Now, the weight gain should pick back up after the first to second week of life. And again, talking with your pediatrician about that situation is how you know if your supply is enough. The breastfeeding benefits for babies can include I'll probably do an episode on that by itself, but there's actually a pretty big list. It can include healthier gut microbiome, and for preterm babies, a decrease in something called necrotizing enterocolitis, which is life-threatening. So it really protects the baby's gut and helps the baby do gastric emptying. It can protect against other infections. There are immune proteins called immunoglobulins from the mother that pass into the breast milk and then into the baby. So that can protect against other respiratory viruses and actually ear infections within babies' first 6 months to a year of life and even beyond. So there's definitely benefits for baby. For mothers, there's benefits as well. Some of the benefits include spacing pregnancies, because the more breastfeeding relationship, the more it delays pregnancy. Now, in those who don't have access to contraceptives and in developing countries, that's really important because it increases maternal health to space pregnancies more than having them back to back. It also can decrease cardiovascular disease and breast cancer. So really great benefits. Talking about recommended timeframes for breastfeeding, the American Academy of Pediatrics, American Academy of Family Physicians, and American Academy of Obstetricians and Gynecologists, ACOG, all recommend breastfeeding, exclusive breastfeeding for 6 months, meaning your baby's not taking any supplementation until it starts, eating solid supplementation like foods and stuff. So exclusive breastfeeding for 6 months, and then continued breastfeeding afterwards until a year. The WHO has a longer recommendation of breastfeeding until and through the second year. So those are what those primary societies recommend when possible. But of course, we want babies to be completely healthy, and sometimes supplementation is necessary medically. But that's in the case that it's not. That are the recommendations. So I want to move on to some of the questions. I see that I've already blown past my 15-minute goal here, but that's me. I talk a little bit too much. I get excited about education. But let's talk about the questions, since I did promise I was going to answer those questions. So let me find them. Okay. First question is preparation to do before the baby arrives or while pregnant for breastfeeding. So I think the best preparation is education. So unfortunately, I was planning to actually try to take some breastfeeding courses. Many hospitals offer them, but during the pandemic, often the in-person classes aren't being held. But there are online breastfeeding courses. I can't recommend a specific one. I haven't seen them, but that's something to look into. Another way to get education antenatally before the baby comes about breastfeeding can be by hiring a lactation consultant privately. Many of them will take insurance and it will be covered by insurance. So Google ones in your area. They can either do virtual visits or in-person visits, depending on your risk profile and COVID and things going on, et cetera. But taking a breastfeeding course and understanding about breastfeeding and learning, I think, is the best way to go for preparation for breastfeeding. I also think having conversations with your partner about ways that they can help you. Just because you're the sole provider of the physical nutrition for the baby, they can be changing diapers. They can be doing a lot of other things to help you and help support breastfeeding. Next question. Since you can't measure ounces, how do you know when the baby has enough to eat? So I alluded to this before, but this is something that you discuss with your pediatrician. There is some expected weight loss that would be normal in the first few days to a week of life. And then there is, beyond that, an expected amount of return to birth weight and weight gain. The really important thing is dirty and wet diapers, especially. There are specific criteria your pediatrician can go over with you. So that's how you make sure. There's not a way to be sure after each feeding how much your baby gets. You can do weighted feeds with your pediatrician. But I know that drives a lot of anxiety, not knowing hour to hour if your baby's getting enough, but it's really kind of like looking back on a 24-hour period, how many wet, how many dirty diapers, looking back on like every other day, possibly at the pediatrician, weighing, et cetera. So that's something to talk about your pediatrician with. Thoughts on galactagogues. Okay, galactagogues, that's the word for supplements and things that increase breast milk supply. So this is a really tricky topic. We don't have a lot of data and research on breastfeeding. I would love to change that. NIH, let's get more funding for studying breastfeeding so that we can find things that actually do increase supply. But in general, galactagogues are not recommended. Two things. There are two types of medications that are sometimes used as galactagogues, although they tend to not be recommended by professional societies. You may have heard of them as Reglan, which is a nausea medicine, metoclopramide. One of the reasons that this isn't really recommended, the data for it working isn't that great, and there is actual risk. It does go into breast milk and possibly cross the blood-brain barrier. There are some maternal side effects that, if they are rare, but they can be permanent, like neurological issues with movement disorders. Again, they're rare, but there are some real risks, and the data for them working isn't great. So I don't recommend that. There's another one called domperidone. It's not available in the US because of its effect. It can have some effect on the heart rhythms, and it does cross into milk. So, but there's not good research on if it can affect the baby's heart rhythm. So again, I don't recommend that. It's not even available in the US. That one, I prescribe Reglan only with a lot of caution and really good counseling with patients. So it's not that I never prescribe it, but I don't recommend it for everyone. And I really have a real conversation with patients about risk benefits. There are, of course, supplements that a lot of people talk about as increasing breast milk supply. The most popular one is fenugreek, but there's other supplements that some people claim will increase breast milk supply. They also don't have great data, right? And supplements are not regulated by the FDA, so they don't have to prove efficacy. So you can just sell a supplement that says like breast milk supply increasing supplement, and there's no accountability for being able to make that claim. Again, there's not great data that fenugreek really works to increase supply or not. Could there be in the future? I don't know. There's not great data. I tend to go about herbal supplementation for breast milk supply in a risk benefit scenario with a patient. If I don't think there's a chance of risk, I think it's fine to try them. That's how I feel about fenugreek. Side effects are mostly mild, things like GI upset. There can be electrolyte abnormalities. I haven't seen that personally. Other supplements you should talk with your physician about though, because they could have actual risks and we'd be on safe supplements. The biggest thing I would say about increasing breast milk supply, and this is what I talk to new parents about, is that make sure you're drinking enough and staying really well hydrated, and make sure you're eating enough. Sounds like common sense, but it's not, especially when you're caring for a newborn. It is hard to stay hydrated and to make enough time and effort for enough food when you are just like so concerned with the baby. You go to eat something, you heat it up, and then the baby is ready for you again, and you get distracted by comforting the baby. You forget to eat, 2 hours goes by. Suddenly you realize you're not taking in enough calories. Make sure that you're getting enough protein, that you're getting enough fiber, that really helps, and enough really good healthy fats, avocados, olive oil, almonds, things like that. So my favorite things to increase supply are the food and nutrition and mental health. Make sure you're asking for help if you're overly stressed about something. That's not going to be good for your supply either. So those are the things I recommend in terms of supply. Next question, birth control and breastfeeding. Excellent. So birth control and breastfeeding is a topic I have Instagram posts on. Just as my quick counseling, I counsel about this all the time. Breastfeeding exclusively itself has been studied as a method of contraception. It's called lactational amenorrhea, and it can actually be quite effective, over 95%, when certain criteria are met. One, the baby actually nurses at the breast for every feeding. Not many people are doing that, especially realistically when you have to go back to work. Many people are pumping and then supplementing, and we don't know how that affects the efficacy. Does it not affect it at all because your baby only eats breast milk still, whether it's pumped or eating at the breast? We don't know. I would love to see that data. It also only applies if you haven't gotten your period. So if you're getting your period back, then you're probably having escape ovulation. Also only applies if your baby's only eating breast milk. So your baby can't have formula supplementation, or if it's time to introduce other foods, that means that your baby's getting other nutrition and that it's no longer reliable. Prolactin, that breastfeeding hormone, suppresses our hormones for ovulation and menstrual cycles, but we don't know exactly for each person when that level of suppression ends and the ability to ovulate returns. And it can happen before a period comes, because a period is usually your body's response to an ovulation event that didn't result in a pregnancy. There are many methods of birth control that are safe for breastfeeding, including all progesterone containing only methods, IUDs, the implant, the shot, progesterone only pills, and then non-hormonal methods like the copper IUD. The one thing we try to avoid is combined hormonal contraceptions. So the vaginal ring, oral contraceptive, combined pills, and the patch, because the estrogen that's in them can negatively affect breast milk supply. Not for everyone, but for some people. So when I have this conversation with patients, I say, I don't recommend you starting that with breastfeeding until your supply is really well established, perhaps at about 2 months, 3 months postpartum. If that's the method that you really prefer and you want to use it, then you can start it and monitor your supply. I've had people say after a week, this didn't work, my supply went down, I'm stopping. I've had also people say, oh, I started again and my supply was fine. So I don't recommend that in the beginning, although it can be used later on because it theoretically can affect supply. All right, last question, thoughts on breastfeeding while pregnant? This is a topic that I think is really cool. So a lot, you can hear old-fashioned advice that says you can't breastfeed at all once you have your next pregnancy. And that I don't agree with. So there are theoretical risks that the stimulation of the breast can cause contractions or early labor. We haven't seen data to support that stimulation of the breast, especially less stimulation by an older child who's breastfeeding, someone who's after 6 months, after a year, being enough to cause labor. What I would say is to the person doing it, if you start feeling contractions while you're breastfeeding and you're past 20 weeks of pregnancy, that would be a sign to start kind of pulling back. But if you are not feeling contractions, then I think that's a safe thing to do, absolutely. Before 20 weeks, I don't see a problem with it either, especially if you're not having cramping or contraction. So just watch out for that. The other thing is, there's one more thing I was going to say about that. It can be totally healthy. Some women keep a breast milk supply throughout a pregnancy until that supply kind of changes over for the new baby into like a colostrum and a breast milk composition that's for a new baby. But a lot of people, their supply ends up drying up, especially at the end of the first trimester, if not sooner, during the second and third trimester. So just something to be aware of, that sometimes your breast milk might dry up with pregnancy, and that's because of the hormone. But I would say there's no big concerns there, but it's just a case-by-case scenario. If you're feeling contractions or you're worried, then maybe it might be time to stop. But if you are having a great experience with continuing to give breast milk while pregnant, that's fine to continue. I really hope that these have been helpful. Again, this went on a lot longer than I thought. I tried to be concise, but there's so much information I always want to share. This will be posted to my page. You can view it later. You can come back to it. You can comment on it, because this is just one of what we can do many videos on breastfeeding, especially some that are a little more rehearsed. But this has been a super fun live stream. Please subscribe to my channel. That's really important in terms of getting my content out there for people who need to see it and want to hear this information. Like this video. I'm looking forward to your feedback, and thank you so much. Bye.